What is going on, busy bariatrics? In previous videos, we've talked about who qualifies and what results you can expect from bariatric surgery. But now let's cover the part everyone worries about. What are the risks and complications of bariatric surgery? Surgery is incredibly effective, but it is also very serious. So let's walk through what can happen, how common these issues are, and how doctors work to keep you safe. Like any medical operation, bariatric surgery carries short term risks. These can include bleeding, infection, and reactions to anesthesia. There's also the possibility of a leak where the stomach or intestines are stitched or stapled. That is rare, but it is one of the complications surgeons monitor for most closely right after surgery. Blood clots are another risk, which is why you'll be encouraged to move as soon as possible after the procedure. Over the long term, some patients experience strictures, where the new stomach opening narrows and makes eating difficult. Others may deal with ulcers, gallstones, or hernias. Vitamin and mineral deficiencies are common if supplements aren't taken as prescribed. With bypass especially, the risk is higher because food absorbs differently after surgery. That's why follow-up care and lab work are so important. There's also lifestyle-related issues. Dumping syndrome can happen when high sugar foods move too quickly through the smaller stomach and intestines. The result is nausea, sweating, and a very strong reminder to stick with balanced foods. Some people develop new challenges with alcohol because it's absorbed faster and hits harder after surgery. That's not a small risk, and it is something to plan for if alcohol has ever been a concern for you. There is some good news, though. These risks are well known, and your surgical team has systems in place to prevent, monitor, and to treat them. Regular follow-up appointments, blood work, and being consistent with vitamins and proteins keep most patients on track. And remember, the risks of surgery are weighed against the risks of not having surgery. Staying at a higher weight with uncontrolled health conditions for many bariatric patients is the safer long-term option. No surgery is going to be risk-free, though, but the majority of patients come through safely and see dramatic improvements in health and quality of life. The key is following the program, showing up to appointments, and being honest with your care team. So if you're worried about risks and complications, know this. They do exist, but they can be managed with the right care and commitment. If this video helped, subscribe and check the rest of this top 10 playlist, and let's keep getting busy.